everyone, it's Dr. Candace and Dr. Max from APM Sports Chiro. Today we're going to go over sciatica. What is sciatica? A lot of people toss around the term of sciatica. They think they have it, they suffer from it. They go on Google and they learn all kinds of things about sciatica. But what is it actually? So sciatica is when one of your discs in your low back is herniated and it's pushing on the nerve root where the nerve comes out of the spine. And that causes a whole myriad of symptoms.
And how this starts or how it happens is, with many different ways. So it could be something that, injury happened. You could have had that maybe the disc have already been kind of herniated, and now it's just hitting that nerve a little bit, and it's causing that pain. That classic sciatic pain, like down the leg, where people say this unrelenting pain, where they move, they do this, things like that. So there's a lot of things that can cause sciatica. Repetitive motions. We see that a lot with people, whether it's work or yard work, things like that. You're constantly bending, you're moving, you're lifting things, and that repetitive motion just causes, a natural breakdown in the body to cause an injury.
Yeah, so how do we diagnose it? Like I said, a lot of people hop on Google and they follow Dr. Google and they think they have sciatica. They come in, they tell us they have sciatica, the pain is so bad down their leg or whatnot. So the way we diagnose it is by taking a full history. There's certain things we look for that the patient's going to tell us that basically will let us know from our training that they are suffering from a true disc herniation. There's also different orthopedic tests we do, different range of motion. So we go through a full exam to help us diagnose sciatica. And then sometimes, we have to send out for an MRI. So, sometimes refer the patient to an ortho to get an MRI to get some imaging. But it's really important to correlate what the clinical signs and symptoms are with the imaging, because the imaging sometimes can show some herniations that you've probably had a long time throughout your life and they're not causing any symptoms. It's really important to correlate what you're telling us, what your exam findings are with the imaging.
And so what we're going to do after we find out that you do have sciatica, so there's a lot of next steps that we're going to take, including different treatments that we have in the office, which include laser therapy, adjustments, Graston tools or scraping, things like that. But we're going to talk about that a little bit more in the next upcoming videos. So stick around, and if you have any comments, put them below or hit us by APM.